Our current understanding of ALS is that it's a problem with a protein called TDP. That this TDP protein is not where it's supposed to be. It is instead sort of globbed up in other parts of the nerve cells. We are now starting to try to be able to fix that. The first trials of products that have the potential of curing ALS are now in trials. ALS remains a disease that is difficult to diagnose early on. The first problem that people with ALS will notice tends to be sometimes muscle twitching, muscle cramps, and sometimes weakness that comes and goes a bit. Those are all symptoms that I think all of us have had at some point, but these symptoms keep getting worse, and that's when the diagnostic journey starts. We listen to people's history, their story. We do a physical exam, and we also use a EMG, an electrophysiological test of muscles and nerves. But to that, we have now added a blood test, neurofilament light, which is good at detecting ALS, and it's a blood test. It's very easy to do. And we have a new measure of the brain involvement in ALS, the high-strength magnet cameras looking for a motor band sign. And that's another new test. So there are some people who we now can make a much earlier and more clear diagnosis for. We collect samples to better understand the underlying molecular pathology, sort of what really is going wrong with the nerve cells. In addition to that, we work with groups here at Mayo who try to find new ways of measuring ALS. If we could measure the effect of the drugs that we're testing better, we might be able to move the drugs faster towards approval and drugs being available to people.